welcome back to my channel. I hope everyone is doing well. In this video, I'm going to do something totally different from my normal videos. So as you can tell by the title, my son broke his clavicle, his left shoulder. Is this my right or my left? This is my right. But he broke his left shoulder, and I'm going to talk about the whole experience. I just wanted to share our experience and hoping that it helped others as well. So to give you guys a little backstory, my son is 15 years old and he plays high school football, and he was in practice, right? So he was in practice, he was all geared up, of course, and one of the kids went to tackle him, and the kid went, towards him with the helmet like this and went straight to my son's shoulder, and it cracked the collarbone, okay? And the crack is dislocated. It's a dislocated fracture, so that means that it's not, okay, so here's your collarbone, and if it's fractured, say the fracture is right here, right? So this is when it's not dislocated, but there's a fracture there, and when it's dislocated, it's like out of place. So it could be like this. So he had a dislocated fracture, okay? So anyways, I have notes on what we're going to discuss today. So we're going to talk about the pain, the decision to have surgery, how to get dressed, right? We're going to talk about comfort. We're going to talk about caregiver burnout. We're going to talk about incision care, and we're going to talk about exercises as well. So if you have a child or a spouse or a loved one that just recently fractured their shoulder, this video is for you. Alrighty, so I do want to show you guys the X-rays, and then we're going to get into the topic of today's video. So here is the X-ray of the actual fracture, and I'm going to bring it really close to the camera. And as you guys can see, this is the left shoulder, and you can see that it is displaced right here, and you can see that it is displaced right here as well. You can see the bone going this way, and then this bone is going up like this, and the ortho said that it was broken into 4 pieces. So that is the X-ray. Okay, so let me show you guys the after. So after having the surgery, so this is what it looks like after. So he does have screws, and we are very happy with the results. So this is his after, okay? At first, I want to go back to the day of him having that incident. So I was at work, and it was towards more of the end of the day. So anyway, so I am talking to a client. So I'm just talking, and then I get a text message. But I read the text message, so I'm just still talking, right? And I seen that his father called. I believe he called once or twice, I can't remember. And I knew something was not right. So I was like, so anyways, I looked at my text message, and my son's dad, my ex-husband, was like, Bryce broke, there's a possibility that Bryce broke his shoulder, and I'm going to the school right now, or something like that. I'm gonna go pick him up right now. So anyways, I was talking to the client, I was like, I have to go, I didn't want to seem like something was going on, but I was like, I have to go, So I hung up the phone, and I'm like, oh my goodness. So the first thing I do, I call him, and he tells me what happened. So I'm like, okay, I'm on my way. So I'm getting in my car, I'm an hour away. So anyways, I asked him, I said, do you want me to come straight to the hospital? What do you want me to do? Because we didn't know what was going to be the situation. So he was like, you could just go home, and then I'll let you know if I need you to come to the hospital. If he's gonna have surgery, then you could take over, or whatever. We wasn't sure. So anyways, I went home waiting, of course, just like, oh my God, what's going on? And then I was praying and all that. And then he called, he said, took him to the emergency room. He did have a fracture, and that they said just go to an ortho. So he said he's gonna bring my son home, and I was like, okay, I'm gonna go ahead and get some pain medicine. So I went to the pharmacy. I got ibuprofen and I got Tylenol for his pain. So he came home. His dad already got him dinner and all of that. So I just had to make sure that Maddie was eating and get his pain medicine. So I was giving him his pain medicine. He was in so much pain, guys. He was in so much pain, and I was in pain just watching him in pain, right? So that very next day, I started calling orthos and things like that, orthopedic surgeons, to get him in. And I was able to get him in that afternoon, which was really good. So all I did was kept him comfortable, gave him his pain meds around the clock and things like that. Then we went to see the orthopedic surgeon that afternoon, and he said, you can let it heal on its own, or you could go ahead and have the surgery. If you have the surgery, then we could correct it and make sure that it is back to where it needs to be aligned. If you allow him to heal on its own, there's a possibility that it could just be a deformed, he could have a deformed shoulder, because you don't know how it's going to heal. And I was like, my baby's having surgery. We're not gonna play those games. I'm not playing with that, okay? He's young, he's healthy. I know he can handle the anesthesia. There was no question. We said we want to have surgery. So we went up to the front and we scheduled the surgery for, it was like, so he had the incident and he had surgery literally like a week later. So it was like 5 to 7 days he had the surgery. So that was the decision why we had the surgery. We just didn't want to play around with him, his body, you know, healing the way it was going to heal. I just didn't want that to be that for him. I feel like he was too young to allow his body to just heal how it's going to heal. I didn't want him to have to like live with this deformed shoulder. So we said, yeah, we're gonna have the surgery. All right, so let's talk about the pain. So after the incident, he did have a lot of pain. Like I said, I was giving him Tylenol and ibuprofen. I was alternating it and giving it to him around the clock because it was very painful. And I definitely wanted to make sure that he was medicated before we got him dressed, okay? So that way he's not in a lot of pain. So we did that, and then right before surgery, like 3 days before surgery, we had to stop the ibuprofen. You're really supposed to stop ibuprofen 7 to 14 days before surgery, but I didn't even think about it. So yeah, but it was like 3 days before surgery, we stopped the ibuprofen, and that is so that way they don't bleed out during surgery. But I said it was okay because he's young. After the surgery, he was in a lot of pain. I felt so bad for him. It was a little tough after surgery, okay? But he did have Percocets that the doctor prescribed that did work. We did do ice pack on the shoulder as well. And he had antibiotics. Make sure that I had him take all of it and on time. He also was prescribed some medications to help with like just relaxing the muscle. So it was really good. Like they did what they were supposed to do. And he also was taking a stool softener, so that way the pain medicine did not make him constipated. And he took his pain medicine for about 2 days, and then he stopped taking the pain medicine, but he completed the antibiotics and that. So that was good. So the pain was a little, you know, it was painful. It was painful before surgery for sure. It was painful after surgery for about 2 days. So that's not really that bad, okay? Okay, so let's talk about getting him dressed in the morning. Oh my goodness, it was so painful to watch him in the morning and just trying to get him dressed and just trying to help him do everything. But you know, I'm a nurse, so I was blessed with the fact that I already knew the techniques of helping someone get dressed when they are, you know, in pain, or they have a deformed arm, or if they have, you know, a stroke on one part of the body. So I'm going to show you guys how you should dress your person that has a deformed arm, okay? So when you're helping that person get dressed, number one, if you have a button down shirt, that would be the most easiest way to do it. But we decided to let him go to school the next day because the orthopedic surgeon said that he could go back to school. They did give him a sling in the emergency room, so he did have a sling. So, and my kids always went to a private school. They don't go to a private school now because they're older. They go to a charter school, but they still have to wear uniforms. So my kids are always, they're used to wearing school uniforms, okay? So I say that to say that I could just put him on a button-down shirt, right? You have to put on the school uniform. So anyways, so I'm trying to think how you do it. All right, so what you want to do when you want to dress them, and it's a pullover shirt, so you don't have the option to do the button down. So you want to take the pullover shirt, and first you want to dress the bad arm first, okay? The bad arm goes in first. So you want to take the shirt, put it through the bad arm. So the bad arm is just going to be hanging most likely, right? So you're going to take the shirt and you're going to just pull it through gently, very gently. And then once the shirt is up here, then you can go ahead and stretch the shirt over their head, and then the good arm can do all of the work, right? Putting in the shirt versus trying to do it the opposite way, okay? So when you're removing the shirt, you want to remove it through the good arm, the arm that can do its thing, that's flexible, that can move properly, right? So you're gonna remove it through the good arm, go over the head, and then you slide it through the not so good arm. We don't want to say bad arm, the not so good arm, right? So that's how you put it on and take it off. Now, if you do not have to worry about school uniforms and things like that, then a button down would be so much easier. You still want to put it through the arm that's not working that's great, and then the other arm will do the work, and you take it off the same way. You're gonna go through the good arm first and then remove it through the arm that's not working as great. I hope that makes sense, okay?
Alrighty guys, so we was able to film a real demonstration on him putting on a button down shirt. Of course we did this after surgery. Before surgery it was just too much pain to even film this, but now that he's a lot better, we wanted to demonstrate how to do this, okay? So with a button down shirt, it would be easier. So of course you want to put the shirt through the arm that is effective first, and then go ahead and put the shirt on through the good arm, okay? That makes it really simple, pretty simple and easy. So this is really good for the day of surgery, or if you just want to lounge around, a button-down shirt is the way to go, okay? I know button-down shirts are not the most comfortable to wear when you just, laying around or whatever. But we're going to show you how to put on a pullover shirt as well, because this is what he really had to wear when he had to go to school and such. So first you want to pull it through the effective arm first, like we said, okay? So you're gonna put it through the arm that is effective first. This is perfect for someone that had a stroke or just having a lot of pain, and of course, a clavicle fracture, okay? And then we're gonna go ahead and stretch this part of the shirt and put it over his head, and then he could go ahead and put the shirt on with the good arm, okay? So that's how you put on your shirt. And then after this, we're just going to put on the sling. I didn't want to do this part at fast speed because I know a lot of people probably don't have any kind of nursing background, so I wanted this part of the video to be where you could go back and watch it again or whatever, and I didn't want to speed it, okay? So that's that, and we're going to put on the sling as well. I just want to say that I'm so proud of him. He did really well. Before surgery, he did good. After surgery, he did good. Everything is healing really well, and the incision looks really good. We'll show you that towards the end of the video. But yeah, really proud of my man here. He's still wearing the sling. He has to wear that for about 6 weeks after surgery. So we're not quite at 6 weeks, but this is my handsome young man. And here I'm going to show you guys how to remove it, okay? So it goes through the good arm first. And if you need to stretch the part that goes over the head, go ahead and do that. And then it makes it really simple and easy to remove it through the affected arm. So that's how you do that, ladies and gentlemen. So yeah, let's continue on with the rest of the video.
Now we're going to talk about comfort. I think comfort is so important. First, I'm going to talk about my first mistakes, okay? So the first night that my son fractured the shoulder, I had him sleep with me. Now, him sleep with me was not the mistake. Him sleeping with me and my bed is up high was the mistake, and I didn't even realize this, okay? I did not even realize this. But I did have him propped with pillows and things like that. But trying to help someone feel comfortable in and out of a high bed makes it even more uncomfortable, if that makes any sense, okay? So yeah, he was sleeping in my room. I had pillows behind his back, had him really comfortable, but when it was time for him to use the bathroom and time for him to reposition, and he just wanted to get out of bed so he could just take a walk, that was a task because my bed was so high up. So I had to help him get up, you know, help him sit up, and then help him position his leg out of the bed, and then help him get out of the bed. So that was a pain, but having him sleep with me was a great idea because I could keep an eye on him while he is sleeping. But we realized after surgery that the best way for him to have comfort was the couch, and I didn't even realize that. I wasn't even thinking about that because the couch is nice and low, easy to get in and out of, easy to prop pillows, very comfortable, and I have a sectional, and that just made it really comfortable. And I was able to sleep on the other side of the couch as well, and to be there with him throughout the night. But I wish I knew that in the beginning, okay? And another thing we did to make his, you know, situation more comfortable was to have a small bedside table right next to the couch, so that way he could have water when he wanted it. And he had his, you know, remote control, he had his game system and his phone and all of that right next to him, and it made it easier for us than to keep bringing in what he wanted, like water, food, or whatever. Everything was just right there at the bedside, right next to the couch. So that was good. So have like the little table right there and ready, okay? Trust me, you thank me later.
Alrighty, so this was the after surgery setup. The first 2 nights was a little rough just because we're not used to sleeping on the couch, but it got so much easier than the high bed, easy to get in and out of. Then it became very comfortable. I say night 3, we got used to it. This is the side I slept on. So it was not bad at all. And like I said, it became really comfortable. This is his medications and his post-op instructions and such. But like I said, I just wanted it to be comfortable for him and have a very easy setup next to him as well with his, you know, equipment. The remote control, things like that. Water always at the bedside, at the couch side, I should say, and his food. So not too bad at all.
Okay, so another thing that I really wanted to talk about is caregiver burnt out, okay? So this is very common and it's going to happen. You're going to have a little bit of caregiver burnt out if you are the caregiver, and that is okay, but I'm going to help you avoid the caregiver burnt out. Number 1, you don't want to lash out on the patient, okay? You don't want to be like, I am tired of you. Even if you want to say it, you don't want to say it. but you want to still do things throughout the day that makes you feel like you're escaping from the situation. I definitely feel like I had moments where I needed to just not be here right now, even though I am here right now, right? So I think it's very important to just do some things that make you happy, the caregiver, okay? I had to tell my son, okay, all right, Bryce, I'm going to take a few calls for about an hour or so. So I just need you to just chill, okay? Just chill. And the reason why I was still taking calls from my clients is because I needed to just not feel like this was going on right now. It was a lot, you know? Because when you're the caregiver, you are there for them around the clock. There's no one here to be like, let me rescue you, okay? But I do have 50-50 custody with my ex, but I did have my son majority of the time after the surgery. We had the hurricane came as well after that, and yeah, I had him most of the time after the surgery. He wanted to be with me. I feel like, you know, kids prefer to be with their mom because we're just a little more compassionate and we just give a little more love and a little more tender care. So he did want it to be with me, but I just needed him to just give me like an hour every once in a while. Like, I just need a break, okay? So I think it's very important to just be able to escape just a little bit when you're caring for someone around the clock. It's okay. It's okay. I remember one Sunday morning, I woke up. I was so tired. I was just so tired. And I didn't give him breakfast the next day. I was just like, I'm sorry, but I just need to sleep. Like, I just need to sleep. He was mad at me. I know he was, but I just needed to sleep, okay? Yeah, caregiver burnout is real, okay? Just take care of yourself as well, mamas. Take care of yourself as well. If you're a wife that is caring for your husband in this time of need, take care of yourself as well, okay? It would be good for the person you're caring for and for yourself as well, okay? That's caregiver burnout. Take care of yourself. Escape a little bit. Take that phone call, okay? Woo! Yes. All right. Now we're going to talk about incision care. So, as a nurse, I did not want my son's incision to get infected. Like, I was already like, we're going to make sure this does not get infected. I want to make sure that I care for this. I want to make sure that the incision heals well and all of that.
Alrighty guys, so this is after his first shower, and I'm going to go ahead and remove the original dressing that the orthopedic surgeon put on after the surgery, okay? So he had this original dressing on for 7 days, and like I said, this is after his first shower. We're going to remove the dressing, see what it looks like, and I'm going to decide what I want to do with it. Remember, I am a registered nurse, okay? So just keep that in mind. Please follow your orthopedic surgeon and nurse's instructions when it comes to incision care, so that way your child's incision does not get infected, okay? So anyways, I'm looking at the incision site, and I wanted to leave the area open to air, meaning I don't want to dress it. I just want to leave it alone and let it do its thing naturally. But I decided not to do that because a small area was still open and you guys will see that. So after the shower, well, actually in the shower, I did apply some hydrogen peroxide. So this is after the shower that you guys are seeing his skin, okay? And yeah, added some hydrogen peroxide to the area. And then now I'm going to just oil his back, and as I'm oiling his back, you'll see that there's a slight area that is bleeding. So what I decided to do is add some triple antibiotic ointment. You don't see me doing this. I did this off camera, okay? So I added some triple antibiotic ointment to the area, and then I took some gauze. I added some gauze to add, a little pressure to the area. Not me putting pressure. The gauze is the one that's adding the pressure, okay? So I added some gauze to the area and some paper tape. And that's what we did, and we kept that on for about a day. I changed it, then I noticed that it was still bleeding, so I said, you know what, let's stop the showers. Okay, we don't want to keep getting this wet. Let's go ahead and just do bird baths and make sure this incision stays clean and dry, and we're not constantly messing with it. Okay, so the second dressing I did, I went ahead, did the same thing, clean it with some hydrogen peroxide, and then I apply the triple antibiotic ointment on there, put the 4x4 gauze, and cover that with paper tape. And yeah, we were good to go. And that cleared that up and fixed the problem. So like I said, follow your orthopedic surgeon's advice when it comes to wound care. If something doesn't look right, call them and go back in, okay?
We are at post-op, and it looks good so far. How you feel, Bryce? Good.
Your functions, which basically means you're going to follow my commands. Okay, go ahead, give me 2 thumbs up here. Give me okay signs. Cross those fingers. Spread them real wide. Give me a kiss. And back and forth. Almost all the way straight. Beautiful. Flip them over. Now time to show it off. Let me see how high. Fantastic.
That's fine. You heal really good.
That's
Your
good.
skin looks really good.
I just didn't want it to get infected. That was my biggest thing.
Yeah. Skin looks really good. Usually it's a lot of blood and stuff like that coming out, but
Oh, wow.
sorry, but this is the sensitive one here.
Mm.
Got 4 more. A little break. So I'll put some ointment on there. I'll put these steri strips on there. These steri strips, they can get wet.
Okay.
So just don't peel them off. Just let them fall off themselves, okay? One more, okay?
The last one.
Last one. All done, buddy. Good job.
And the sling still stays on, right?
Mm-hmm.
Okay.
Let me get dressed. I'll be right back, okay?
Okay, thank you.
You're welcome.
Alrighty guys, so this is 3 weeks after surgery and his incision looks so good. This is every nurse dream. Look at that incision line, looking nice. I love it. Let you hear his reaction.
Are you happy that you had your surgery, Bryce?
Yeah.
What is your pain level from a scale of 0 to 10?
Right now, 0.
Yay! Awesome. The scar looks so good. So proud of you. Looks really good. Wow. So yeah, I would encourage him to show me his exercises so that way I can just make sure that he is doing what he's supposed to do. You know how kids are. And yeah, just was like, are you doing your exercises? Show me how you're doing it, and make sure you do what your therapist say. Are you supposed to do it twice a day? Do it twice a day. Okay, so definitely make sure they get their exercise done and all of that great stuff. Are you gonna do a few exercises? You can do one exercise. Want to show them one exercise that you do?
This is one. Just a basic curl.
Cool. Do you want to do another one? Just one more?
Just one.
It's dark in here. It's the light from the window. Good job, Bryce. Alrighty guys, that is it. Oh, and I did want my son to come on here and talk about his experience, but he was like, if I talk about my experience, you're going to be mad at me. It's not that he had a bad experience that he don't want to talk about. He's just not happy with the fact that we're not allowing him to play football anymore. So he's not happy about that. So anyways, thank you so much for watching this video. If you like this video, give it a thumbs up. And yeah, thank you so much for watching. And I hope you are able to do well with taking care of your loved one that may be having surgery for your shoulder. It's gonna be okay, okay? It's going to be okay. And if you're the one that's having surgery, good luck to you. I hope everything goes well. Thank you so much for watching. And if you guys want the information for my orthopedic surgeon, I will leave it in the description of this video. He did a great job. Highly recommend him. I give him 10 stars. So anyways, thank you so much for watching this video, and I'll see you, yes you, on the next video. Bye. Ciao for now guys. Bye.